Well, hello and welcome to another Thursday Live. This is Dr. Jerry Dreessen. I'm the Executive Director here at the Association of PEMF Professionals. And today we are going to be talking about some pretty cool stuff. It has to do with our live stream series that we're starting up a new one. And why do people use PEMF? And particularly today's or this week's live is going to be on human studies supporting post-op rehabilitation and recovery. And it's a little misleading because I did throw in some animal studies in there as well, and how a lot of times studies they do on animals pertain to humans too, but we'll learn a bit more about that together. So with that, we're going to jump right into all of this. And let's start right out of the gate with plastic surgery recovery. And what was interesting about this study, they did a clinical review from the plastic surgery field. And those surgeons that use PEMF to manage pain and edema, which is swelling, after procedures like breast reconstruction or facelifts, it also seemed to speed up wound healing. And so pain management, edema, and wound healing on this study. And I have, those of you that know me, I have seen this firsthand with one of my patients when they just had their tooth pulled. The whole side of their face was swollen. And we used the small double loop over the face in a 10-minute procedure. During that time, we saw the swelling, you saw it shrink. It was like probably 60-70% less swollen afterwards. And those of you that have been following me for a while know how much I kicked myself over the fact that I didn't film that happening, because I didn't want to send him back to the dentist to have another tooth pulled just so I could film it. But it is really good. Those of you that are using it on people with infections or swelling post-surgery, you know what I'm talking about. But those of you just watching this for the first time, again, this is some pretty amazing stuff. And in this study, one of the standout cases involved a 72-year-old man with a non-healing chest wound after coronary artery bypass surgery. And after 8 weeks of twice daily 30-minute PEMF sessions, the wound fully closed. And again, when we're out doing these types of field things, or even like this, we can get the results, but afterwards was like, okay, how long was it? What was your setting? You know, was it directly on the skin? Was it over clothing? Was there any prep? Did they drink water? Are they on any medications? There's a whole lot of things that are going on. You know, how old was the person? 72. What was their health history? Were they a smoker? There's so many other things that can be part of that study. But just so you know, they had some good results with what they did. Now, beyond wound closure, patients reported less pain and swelling, suggesting PEMF could smooth out the recovery process by calming inflammation and encouraging tissue repair. So that's the big take home on that one. Now, the next study, we had knee surgery rehabilitation. Oh, and again, I want to thank those of you that are joining us live and inputting your information. We'll be jumping on and answering those live. But if you yourself have a really cool experience with PEMF on this type of information we're talking about, definitely drop it in below so other people can see it. So we are talking about knee surgery rehab now. And this is a randomized controlled trial looking at PEMF in patients recovering from arthroscopic knee surgery. That's where they go in, like 3 incisions, and they'll go in and like work on the medial collateral ligament, or go on anterior cruciate or posterior cruciate, or doing stuff with the meniscus where they're going in and they're doing like mini incisions versus like major surgery. And they used a portable PEMF device for 60 minutes daily over 6 weeks. And the treated group showed better outcomes. Pain scores dropped by about 25% more than the control group, and that's the group that didn't have anything done. And the knee function, which was measured by range of motion and strength, improved faster. So you can't argue with that kind of an outcome, especially with that big of a drop. It wasn't plus or minus 5%. It was 25%. And then also, make sure I'm jumping in. Here we go. And then also by week 6, the PEMF group also had less swelling around the joint. This points to PEMF not just aiding in wound healing, but also enhancing rehab by reducing discomfort and boosting mobility post-op. So if you ever have a reason to knock on a door of a healthcare professional and suggest allowing PEMF to be used on post-op, these are some pretty good articles, and you can do a search on the web for these, and you can find them. Next up, we have cesarean section recovery, and a smaller study explored PEMF for women recovering from C-sections. Participants received 20-minute sessions twice daily for 5 days post-surgery. And compared to a control group, the PEMF group had lower pain levels, reduced wound redness, and a faster discharge of surgical stitches, which was about 20% quicker healing time. So the body was healing. It was pushing out the stitches. And again, really cool outcomes here. And this suggests PEMF could ease the early recovery phase, potentially getting patients back on their feet sooner. So just some amazing things going on. And again, thanks to those of you that are dropping in and saying hi. I will definitely drop in and talk to you if you have any questions offline today. My ability to pop you up and say hello is not happening on today's broadcast. So, but I do thank you for dropping in and popping in and saying hi. So, as you see with these studies, these 3 studies alone gives you plenty of clout or information to be able to take what you do out into the world in your neighborhood, your city, your healthcare professionals, and you can do a talk or just a reach out to them. Now, next up, what we've done is pulled some animal studies, because those of you that work with animals, it's like, okay, well, that's humans. What about animals? And those of you that are human, you go, well, there's animal stuff, but what about humans? And in the world of PEMF, we're looking at what happens with cells. And you'll see with these studies how it applies to not only animals, but how there could also be a crossover with humans. So what we have on our first study here is that bone healing after surgery in rabbits. And this one's been around, or has been done quite a lot. And again, what's great about using small animals is it doesn't take much to feed them or store them. You put them in cages, as opposed to a study on horses. Can you imagine doing a study on 20 horses and having to wrangle them? And it's a lot tougher. So when you can have an animal that you can control, you can get faster results and better recording of those results. So they did a study on rabbits with surgically created bone defects, tested PEMF for 30 minutes daily over 4 weeks. So they went in and they did something to these rabbits and their bones, and then put PEMF on them 30 minutes daily over 4 weeks. And the treated group showed 40% more bone regeneration and stronger callus formation. And a callus formation is when you break a bone, then it literally bleeds the inside of the bones, and then that creates a callus. So it's like its own form of blood around the area and creates this callus, which is the scab. But it's a stronger callus formation, which is key recovery after orthopedic surgery. So the marrow goes around the bleed and it creates this callus. And again, it is a way of creating a natural cast on the bone break. And if you can get a stronger callus formation, then of course you're going to heal a lot faster. And then again, while this isn't soft tissue, it mirrors post-op rehab needs in humans, which hints that PEMF could support structural healing and stability during recovery. Again, 6 weeks ago, 7 weeks ago, I did a talk on bone healing, and I talked about the shoulder break a friend of mine had, and we were able to actually heal it 4 weeks faster. It was 4 weeks better on track than what it normally would be for this type of an injury. And there's pre and post on that too. So you can just do a search or just go through our channels, our YouTube channels, Facebook channels. You can find that before and after picture that I included. And then now we have the next study, which is soft tissue repair in rats post-surgery. Rats with surgically induced skin flaps, which is a model for post-op tissue recovery, were treated with PEMF for an hour every day. And again, this is 50 hertz and 1 millitesla. So that's their settings that they have. And they obviously had some way of controlling it. Some machines have that ability. Others, you're set with what is the best frequency. So a lot of times when you have a machine, you can't change those. It's already calibrated to be at the best optimal output. Now, by day 10, the treated flaps had better blood flow and less necrosis. And then the controls with healing rates up by about 30%. And these are, again, significant numbers to see a jump that high. It wasn't 5%, it wasn't 10%, it was 30%. And again, less necrosis. So everything was getting better blood flow. It was attaching. It was revascularizing. So again, the healing was happening at a much better rate, and which also aligns with rehab goals. So as far as restoring circulation and tissue health after surgery, which could translate to human applications like skin grafts or incisions. And again, I always talk about burn victims and getting the skin grafts to take. I haven't seen anything out there yet. I haven't seen a PEMF burn victim unit. Those of you that are thinking about a business, if you could knock on the door of a burn victim hospital that specializes in that and be the go-to person with the PEMF, you would have a lot of business. You would, and you might even have a wing in the hospital for the burn victims where they're doing PEMF. You could be the one coordinating that. So there's a potential outreach there. And here's the study that helps you with that. So with the things that I just showed, as far as the research that's out there, let's connect some of these dots here. And what's exciting here is how PEMF seems to tackle multiple post-op challenges at once. So in humans, it's been linked to less pain, reduced swelling, and faster wound closure, which is crucial for getting through the initial recovery phase. The knee and C-section studies also show how it might improve functional rehab, helping patients regain normal movement sooner. So you can see this pre-surgery, post-surgery, in the physical therapy, even 6-10 weeks later, people who had botched injuries where it failed. I mean, you could put anybody into this category and you'll see how they can get better now. So animal studies also back this up, showing PEMF can enhance both soft tissue and bone repair, which should be a boon for complex surgeries. So even in the animal world, with all of this tissue healing going on. So I think this is a great series that we started with, right out of the gate, some really cool things that are going on here. So, use your imagination on what you could be doing with your PEMF device. Or those of you that are watching this for the first time and are just learning about PEMF, we've got on our website people that are certified, and you can find them by doing a quick search for somebody in your area. As far as the mechanism of PEMF, again, it likely involves PEMF boosting blood flow, dilating down the inflammation, or dialing down the inflammation, and revving up cellular repair. And again, think of it as giving the body a gentle nudge to heal itself faster. That's a really good layman term. We're just giving it a nudge. We're just giving that bone a little nudge to heal faster. We're going to shave 4 weeks off the healing time. Wouldn't that be nice, Mrs. Johnson? Right? So that said, the studies vary in PEMF settings and treatment duration. So there's still some guesswork on the ideal approach. You've seen some examples here. You've seen some times as far as treatment times, session lengths, 30 minutes in some of them. There's been, 10 days. There's been daily for 5. So again, I always thought that the more PEMF you could put in an area for time and repeat that faster, you're going to get better results. That's always been my rule of thumb. So somebody comes in, they go, what do you think I need? If it's a chronic thing, then, come in twice a week, 30 minutes. If it's an acute thing and things need to heal, hey, let's do 15, 30 minutes every day for 10 days straight. Come in twice a day. We'll do, 15 minutes twice a day, 20 minutes twice a day. Those are some things to think about, because this really is a device that does what it says it's supposed to do. And the more time that they can get the PEMF on these areas, the faster the results. Again, always use your protocols, the ones that we teach. Make sure that the person's hydrated. Definitely check any medications that they're on, because they're going to be absorbing that faster. So if you're doing 30-minute times twice a day for 10 days, that's a lot of PEMF going on, a lot of circulation. So if they're on medications, they could be absorbing their medication 2 or 3 times the rate of what the pharmacist thinks they're supposed to. So whatever's on the bottle, if you can imagine saying, instead of taking 1 of these, you say take 3 of these. That's the same effect as far as taking 1 and absorbing it at 3 times the rate. So be thinking about those things too. So that is our talk today on studies supporting post-op rehab and recovery. I threw animals in there too, because there's such amazing things, but this is overall human, because you can apply what was done on the animal studies over on the human side too. I've seen horses. I've seen a great study that was done with a horse where its hoof was all mangled up, and x-rays were done during the process, and you can actually see the bone growing back, and the horse was walking again. So there's lots of really cool stuff that's out there. And those of you that may have been flowing around through the internet, I'm hoping that we can get this person to join us, if not permission to use their images. But now we've got a tiger using PEMF, which is really cool. But we have to wait until we get permission from the zoo to be able to show those. So things that are going on. If you found this information useful, if it's helped you discover PEMF and learn a little bit more about it, or you are using it and you want other people to know more about it, you can like and share this video. We're on Facebook, we're on LinkedIn, we're on YouTube, we're on Instagram. We have our own blog on our website. So jump in there and click like and share all of them. That's going to definitely help out our algorithms. Those of you that are certified members, we've got a members only place where we can jump in and do some chatting there. And then also our code of ethics. Those of you that are wondering who we are, what we're about, this is displayed on our website. So, we're all about taking this science of PEMF and using that to further help humans and animals repair and heal faster through the use of this amazing tool called PEMF. So with that, I want to thank you again. You can become a member today of our association, and it's at PEMFprofessionals.com. We have 4 different types of certification. One of them is just general PEMF, and just to understand what it's all about, you can take that course. But then we have humans, we have small animals, we have large animals. You can take all 4 courses and be fully certified with all of the information that there is on to know about PEMF and how to use it. If you have any questions about this, or you have tips, if you're using it and you saw it today and you go, hey, what you presented was awesome, but there's one thing that you should also try and do, or I found this to be helpful, send us your tips. That's awesome. Then you can send it to info@pemfprofessionals.com. Again, I want to thank you so much for hopping on today, being part of what's going on. And I look forward to seeing you next week on our next Thursday Live. So with that, have a great day. We'll see you in a week.